Well, in tonight's Health Watch, male menopause, myth or reality? Well, it's actually called Andropause, and apparently it's very real. And here to talk about that is Dr. Mitchel Goldman from UCSD. Always great to see you every Tuesday.
Good to see you too.
I jokingly call this menopause, but this is really something serious, and you say it happens to all men. So explain what andropause is.
It really does. After the age of 30, men, even me, we start to lose testosterone at a level of about 1% a year. So by the time we turn into our 60s and 70s, our testosterone levels are almost half of what they used to be. So that has a lot of problems associated with it. Now, in addition to emotional ability, just like women that have it, also with men, a low testosterone is going to decrease our libido. It's going to change our muscle mass, so we have less muscle and we have more fat, especially in the midsection. And also there's problems with sleep. So there's a number of problems that occur with low testosterone levels.
And a lot of men immediately jump to the fact that it can be related to sexual dysfunction, meaning usually a lower sex drive.
It does, but it really isn't. Low testosterone levels are going to do multiple things, including that. So why are we discussing it? Well, it's an interesting topic. I'm 58, but the real reason we're discussing it is that last week in the Journal of the American Medical Association, there was actually a report that came out of the VA medical system where 25% of VA patients that had heart disease developed strokes and heart attacks within 3 years of starting testosterone replacement therapy.
And that is the treatment, but you said just like when women have hormone therapy to deal with their menopause symptoms, these have some serious side effects.
They can. But the important point that we want to make is that if men have heart problems and are taking testosterone, they really need to do it with a physician's advice. You know, you can almost not go online these days without seeing ads for testosterone types of supplements. And if you're going to do any testosterone supplements, because again, 3% of American men are now on such types of supplements, you need to do it under a physician's advice.
Men love to go to the doctor. It's so difficult when they have all these myriad of symptoms. So what is your recommendation? What tests should they get to see if this is in fact what is happening to them? And as a wife, how the heck do you get them to go?
Well, the way you get a guy to go is to say, look, this is a real problem and you can become stronger, sleep better, etc., if you go and you get proper testosterone supplementation. So it is something that you can do.
And how do you test for it?
But it's a very simple blood test to test for testosterone. But what's important is when you start to do testosterone replacement, there are other endocrinological or hormonal tests that need to be done. And sometimes you need to go to a specialist like a board-certified endocrinologist.
Okay, good information. Thank you so much.
Always
I had
good to
no
be
idea
here.
Before you brought this up that menopause or andropause even existed, and I think it's a very important topic and could make a lot of people a lot more happy.
I think so, men and women.
There you go, that's right. So Andrew, there you have it. We're not the only ones that go nuts.
There you go. Stronger, check. Sleep better, check. We could use it all. Thank you very much, Dr. G and Kathleen.